Hello everyone, this is Dr. Parinaaz Parhar, Clinical Head OasisFertility Secunderabad, and today I will be talking about IUI, that is intrauterine insemination. Intrauterine insemination is an extremely popular modality of treatment in ART. What we do here is that in the patient's cycle around her time of ovulation, the male partner's semen sample is processed in the laboratory and placed in the patient's uterus using a plastic cannula. Now this is what we do, to put it simply. Basically, this can be done either in a natural cycle or it can be done in a stimulated cycle. When I say a natural cycle, it means that in your regular cycle with no extra medications given to you, when we confirm that the female partner has ovulated, we prepare her for an intrauterine insemination on the same day. In the case of a stimulated cycle, we might prefer to give the female partner some oral medicines or injectables in order to increase the number of follicles which are growing that month to a maximum of 2 to 3. And once they are ready and have been confirmed to ovulate, the very same day we prepare the patient for an intrauterine insemination. Now, what is done on the day of IUI is that after confirming ovulation by an ultrasound scan, the male partner is requested to give his semen sample. This semen sample is then processed in the laboratory in order to obtain a high concentrate of good quality motile sperms. This processing takes approximately about 30 to 35 minutes, and once the sperms are ready, this sample is then placed in the female's uterus, mainly might be under ultrasound guidance using a plastic cannula. This procedure is painless and it is atraumatic. The patient does not need to take any extra precautions post-procedure, and after mere 15 minutes of rest, she is free to go home. Now, this procedure is very beneficial for a certain group of patients. Those who stand to benefit are those who are suffering from unexplained infertility, patients with irregular cycles where simple treatments like OITI have not really helped, patients who are suffering from mild endometriosis, patients where the male partner is suffering from mildly deranged semen parameters. It also helps those where the couple is suffering from some sort of sexual dysfunction. IUI can also be used for patients where the male partner has no sperms in his ejaculate. In these cases, after proper consent from the couple, a donor sperm can be used and inseminated. IUI in general has a success rate of about 10 to 15%. And the success rate is mainly determined by the age of the patient, the cause for the infertility, and the treatment history in the past. The maximum success rate is in the first 3 cycles of treatment. Another important thing to remember about this modality is that most of the times we as clinicians prefer that the male partner gives a fresh ejaculate for use. But in cases where the male partner would be unavailable on the day of the ovulation, because of travel or because of any illness, a frozen sample can be used.
For more information and updates, subscribe to Oasis Fertility. Hit the bell icon for future notifications.